Hi, I'm Dr. Kevin Milo, one of the co-hosts of the Physician Empowerment Podcast. At Physician Empowerment, we're dedicated to improving the lives of Canadian physicians, personally, professionally, and financially. If you're loving what you're listening to, let us know. We always want to hear your feedback. Connect with us. If you want to go further, we've got outstanding programming both in person and online. So look us up. But regardless, we hope you really enjoy this episode.
Okay, so welcome to this exciting episode in Physician Empowerment Podcast. And this is a new series I promised everyone that we would do, I think a few months, maybe last year, that we're going to do a series on medical entrepreneurship. So I can tell you that I have evolved from just a medical practitioner that practices 100 hours a week to doing entrepreneur stuff, right? And so now I to tell people I'm in double major, right? in medicine and in different kinds of businesses and entrepreneurship. And so along the way, we meet a lot of people that has the same journey. In a masterclass, we gather a lot of like-minded physician colleagues at different stage of their practice, and then they embark on a journey. And at Physician Empowerment, our goal is really to just empower them on their journey. And we're really delighted and privileged to have Dr. Eileen Heo to join us. And she is in Ontario, and she's in the first 5 years of practice. So maybe you should introduce yourself a little bit, Eileen. So where you're at and what kind of practice you do.
Hi, my name is Eileen. I currently live in the GTA area, and I work as a full-time hospitalist in Kitchener, Ontario. So a little bit about myself. I graduated from the University of Toronto Medical School.
Mm-hmm.
And then I went on to do a family medicine residency at the UBC.
Oh,
yeah.
I didn't know that.
On the other side of the country. It was actually the furthest location of the program that I
From home. All right.
Yeah.
So from UBC, then you went back to Ontario.
Yes. Yeah.
Oh, right on. So you're still in the first
home.
5 years. Pardon?
I missed home.
You missed home. Okay. All right. Good to be home, right? So you're still in the first 5 years, right?
Mm-hmm. Yeah, that's
so
right.
Can you share your experience briefly from transitioning from residency to real practice first 5 years? What's the biggest change, biggest shock, and biggest part of adaptation you have to do?
Well, so until kind of the end of my residency, I thought I've never thought I would be doing what I'm doing right now. So I thought I would open up the clinic just like everybody else, do comprehensive family medicine. But then in the last quarter of my residency, I had a few months block of family medicine. And my residency was in Prince George, BC. It's a small...
I know where that is, been there.
Sort of rural-ish city where their family doctors do sort of everything. They see their own patients in the hospital. Sometimes they do merge, sometimes they deliver their own patients' babies and whatnot. My preceptor sent me to the hospital to see the inpatients before the clinic started so that he can focus on the clinic. And I would go and see the patients and come back to the clinic and talk to my preceptor about it. And made me realize that I enjoy the in-hospital care way more than I thought. Previously, like surgical rotations, emergency, internal medicine, CTU rotations really, really scared me for some reason. It's very intimidating. But yeah, that's my experience doing in-hospital care for the patients with my preceptor only. That kind of changed the whole thing. Yeah, so I kind of thought, well, this is not too bad actually, and I ended up filling my elective times with inpatient internal medicine stuff, and that's how I got to be a hospitalist.
Right on. So, what is life like as a hospitalist? Is there more freedom, less freedom than family med in the community?
So, I love my job. I get to spend time with my patients on complex acute medical issues. And depending on sort of like my work is very flexible in a way that if I have a very, very complex patient, I get to spend a bit more time with them and maybe spend a bit less time with my more stable patients because there's no set appointment time that I have to fit patients into. So depending on how the day goes, how I interact with my patients, how much time I spend with them can be very flexible. Yeah, we treat a wide range of acute conditions. And, some patients come to us with, come very, very sick, very ill, sometimes with undifferentiated issues. And it's really fun to get to do all the problem solving. It's intellectually stimulating, and there's nothing more rewarding and fulfilling than seeing the patients that was initially like you thought they were going to die, but then, a few days later, they walk out of the hospital. They and their families are pretty happy. Yeah, so
Amazing.
It's been
Yes.
very fulfilling.
Right on. So what about work-life balance? How do you find that in your last few years of practicing as hospitalist?
So it can be a little bit tricky. I mean, there's a lot of downsides to the hospitalist work as well. It's not for everybody, of course. The workload can be very intense because you're managing very sick, very acutely ill patients. And you also are dealing with the critically ill patients' families and end-of-life issues often, and also dealing with patients and their loved ones coping with the patient's functional challenges that can be very emotionally taxing. So it's not uncommon for a patient's families to come up to me and say, well, my 86-year-old dad used to be able to do gardening. They used to be able to walk around all day. But since he was discharged from the hospital last time, he can barely walk 30 feet with a walker. And other issues like challenges with a long wait period to get into long-term care for those with dementia or severe functional issues.
Right.
And how patients kind of stay in the acute care setting for weeks and weeks and weeks, and the families becoming frustrated and they don't really have anywhere to really rant about it.
I totally agree, because I'm on the receiving end. I do mostly senior homes, one on 50-50, right? I do family med and care of the elderly. And so I'm the getting end, right? So I totally relate. The system is so convoluted and dysfunctional. And so there's now this Canadian crisis that medical graduates do not want to go into family practice, right? So do you sense that? Do you sense what's the prospect of practice of medicine in, let's say, Ontario, in primary care?
Oh, from my perspective, there's no question that there is a family medicine crisis in Ontario. I think probably it's fair to say nationwide, but at least in Ontario, there is a family medicine crisis.
Same in Alberta. We have a big crisis, worse than 30 years. But anyways, carry on.
Yeah, so we have more than 2.3 million Ontarians who do not have a family doctors. And part of the reason is that, the government loves to say, oh, we don't have, we have enough doctors, we have enough family physicians, we don't have a problem. And that's what actually they said during our physician services agreement negotiation between the Ontario Medical Association and the Ministry of Health of Ontario. Their opinion, their stance is that there is no shortage of doctors.
Yeah, it's like there's no problem. What's the problem?
Right. Yeah.
Right. So in Alberta, we have a crisis that the family residency programs are not even filled, 40-60% vacancy, which is first time in 30 years. And there's a recent survey that, whether they say 60% physicians that in 6 months they're leaving or / retiring, and people retiring at in the 40s, which is fake retirement, right? So it's the landscape is getting more hostile. So I know that you became an entrepreneur. So is there something to do with that, with the economics, the finance? Tell us more. What's the journey like?
So personally, don't want to sort of shed too much negative light into
I understand
the perspectives of the medical practice, because I love my job and it's been fulfilling.
Yes.
But it's also the fee increases are strictly controlled by the government, and it has not been keeping up with the inflation. I know, in family medicine, they're probably more affected than somebody like me who has a strictly sort of hospital-based practice. I don't have to worry about overhead. I don't have to worry about rents and paying staff. But a lot of my colleagues who are doing comprehensive family medicine are struggling because of the inflation and inadequate increase in fees. And there's been anecdotally, a lot of my colleagues who are stepping away from comprehensive family medicine practice and doing something more focused, like hospitalist work or emergency, or doing cosmetic stuff away from OHIP covered services.
Right. Yeah. So there's more and more diversification from just publicly funded income to non-publicly funded income.
Yeah.
And then now income outside of medicine or wealth building outside of medicine.
Exactly. Yeah.
So how did you start in the non-medical side of entrepreneurship?
Yeah. And as I mentioned, I really never thought I would be doing what I'd be doing now 5 years ago. Now, I did take a fair bit of time off during medical school and residency due to sort of personal and health related reasons. And so I had a bit of a late start in starting practice compared to my medical school classmates. And also when I finished my training, I had about $300,000 of student loans, and I knew nothing about personal finances. I didn't even know what RRSP was.
Yep, that is so common.
Taxes. And all the financial education that I got during my training was that you'll be fine. You'll be a doctor. You'll live comfortably as a doctor. Period. And there I was with a lot of student debt and really not knowing what to do with that amount of debt, how to pay it off, and whatnot. And also when I started practice as a hospitalist, one good thing about working as a hospitalist is that there's a clear boundary between the on-service time and off-service time. So when I'm working really, really hard. Sometimes overnight, sometimes on the weekends. But then when I'm off for 2 weeks in a row, completely off from work. I don't get any calls from the hospital. I don't have any labs or test results to check on in most cases. Rarely I do get some calls here and there, but yeah. So initially with that kind of a time, I was thinking to myself, what am I doing with my life?
Got time to reflect upon life.
Yeah, exactly. And so, I mean, I obviously took that time to try to create a balance between my work and my personal life. I started to take care of myself. And with someone who's had sort of health issues previously, I know how important that can be to, I know the importance of the work-life balance and really taking care of yourself. So
good for you.
Yeah.
And how does that translate into doing something else? Yeah.
So with all that kind of free time after all the self-care, I thought, well, like I don't really know how to manage my money. Let's, let me also, get to learn more about it. And so what I also learned is that financial well-being is also very important to the work-life balance and also ultimately to the patient care as well, because the lack of financial stability kind of compels you to work more hours, and that leaves little time for rest or self-care or personal pursuits, and that increases risk of burnout and leads to poor patient care and outcome.
I couldn't agree more with that, Eileen. So what's your journey in your quest for financial freedom?
So I kind of started reading about more personal finances. Like I actually got to learn about the RSP.
Righto.
How to invest. Looked into different types of investing, like into stocks and options, and even looked into online e-commerce, and then also got to educate myself with the real estate. And there's something that I really clicked with the real estate, and I just really became attracted to the idea of doing real estate, and that's what I've been mostly focusing myself on during my off-service time.
Right on. So then from being a physician to learn about personal finance, right, financial literacy, to picking an asset class in real estates, that's remarkable. So how does somebody, like we have lots of listeners who just say, yeah, okay, I like to learn about financial literacy and learn about, let's say, real estate. How does one start? Like, where did you go? Is it easy to find something somewhere?
So I kind of started to attend the YouTube University
Right.
initially, yeah.
Right.
And then the online groups where they talk about physician-related financial topics was also really helpful in the beginning as well.
Mm-hmm. And you did apportion time and effort and money to pursue this, right?
Mm-hmm.
Yeah. So I think sometimes we just thought that, okay, so this, after we got a medical degree, everything else we'll learn by osmosis, which is not true, right? We didn't nickel and dime our medical education to become who we are today professionally. So for us to create a second or multiple sources of income, especially passive income, that will one day rival our active income, we do have to expense that too, right? And I agree with you that you start, well, when I started, there's no YouTube, there's no internet yet. So, right, you have to find, I tell you what I mean, there was tapes before CDs, right? And you take expensive courses and you don't know who's teaching you, what's the credentials, right? And that's what led Kevin and I to starting physician empowerment, right? And of course, the masterclass program that we have, and we're really glad to have you, Eileen, and how you flourish and how you move on. So then let's talk about spousal alignment, right? A lot of times, even in a double medical family, right? There's still, if they're in different specialties, there's always, how do you align? But for us who have non-medical spouse, how do you deal with finance and how do you deal with this pursuit of real estate? What's your story in your home, Eileen?
So I became interested in real estate first, and I started to educate myself about it. I enrolled in sort of online courses about real estate investing and also listened to various podcasts. And I actually got to learn about the physician empowerment through listening to an episode where Kevin was there to talk about his experience. And that's how I got to connect with him. And then this community as well. So I kind of lost train of my thought here.
So yeah, spousal alignment. So then you're interested in real estate. What about your husband?
Yeah. So I was talking more and more about real estate stuff, and initially he wasn't very convinced. He actually had some real estate experience previously, but he didn't really buy it initially. And then the more and more I talked about it, someday it seemed to have clicked with him. It's like, oh my God, why am I not doing it? And I said to him, that's right. Why are you not doing it?
Right.
Yeah. And then at that time, the more and more we talked about it, it became clear that we both wanted to pursue it, and that real estate was going to be sort of a way that we could potentially achieve our financial freedom.
Right on. So you got your husband to be on board with you. Yeah. So tell us, what you're doing now and where you're going in this real estate space.
So we have looked at, different ways that we can be involved in real estate investing. And it's sort of natural to kind of start looking around the markets that are closer to you. And that would be Ontario in our case, where the market is already too appreciated, overpriced, and it's kind of really hard to cash flow positive. And it's very difficult, although not impossible, to find really good deals. Yeah, Ontario real estate market tends to be very skewed to being tenant friendly. So it takes a lot of effort, a lot of work to be able to really be successful in the Ontario market, in my opinion, as somebody who's just going into real estate investing for the first time.
Can we just pause there? Let me just reflect collectively upon it, right? Some people say, oh, if I get into stocks, I'll be rich. If I get into real estate, I'll be rich, right? It's not asset that makes you rich, right? It's the ability to maneuver the funds, the cash, and the capital, and sometimes the leveraging power in and out of that asset class. So especially real estate, because it's so illiquid, right? So you can just say, I just cash my stocks. well, sorry, if you want to sell a house, could take you a year to do, right? So the decisions have to be very conscious, right? That the stakes are high, right? And so there's no such thing as Canadian real estate market. There's only local real estate market. It's like, what's the Canadian weather? Well, there's Yukon, there's Edmonton, there's Ontario, Vancouver, right? So in your case, you've done your homework, you've got your feet wet. I know you have quite a few projects going on into multifamilies, whatnot. But then you're finding that, okay, the economic weather, the fundamentals are changing. So how are you guys pivoting and where are you going? Can you share a little bit? What's the next step?
Yeah, so we're also looking at out-of-province markets like Alberta, the East Coast. The rules and regulations are different in each of the provinces. And obviously the local economies are different and whatnot. And then we were thinking, we were introduced to the idea of investing in the US. The markets are much larger there. There's bigger markets and bigger sub-markets. And properties are not as expensive or appreciated as much there overall compared to in Canada, especially in the GTA area.
Right. So I heard a lot about this move, right? This exodus in Ontario. They either go west, go east, or go south, because not much north, right? So, and definitely, some of you know, some of you don't know, I'm Alberta based, right? I'm heavy into real estate as well. So we do see a lot of money pumping from all over, especially Ontario, like buying all our products. And that's why it's hard for us to source good products too here in real estate, I mean, right?
Yeah. And the people that I know in real estate in Ontario are also very bullish on the Alberta market. I know a lot of people from Ontario are going to Alberta market.
Yep, we see them. We work with them and we compete against them. So it's
enemies, exactly.
Right? Yeah. But then south, right? Going south. So just to share a little bit, investing across the border is nothing new, right? But then there's always pros and cons. But because of the change in, again, the environment in a lot of economic landscape, but not just that, but in taxation, right? So this June 25th, okay, we come and gone with June 25th with the capital inclusion rate. And so a lot of Canadians actually, because of that, are planning to leave or have left, like wealthy families and enterprises. And same with this, I heard about this line called the disgruntled Ontario landlords going south, right? So there's the exodus to south. And definitely there is different games, the way that you can leverage, the way they tax, the way that the government creates incentive. South of the border is really, really different than the Canadian sandbox. So I'm not saying that we endorse that as a group, right? And right, but that it's really interesting. This is a move, right? And you're not the only one. We have other masterclass members that going south to actually practice or to buy practices, right? So this is definitely a definite change. But okay, so I think this is really interesting. I hope this would help all of us just sparkle a few synapses in our brain, like from Eileen, your experience, which is from. Let me recap, right? First 5 years from residency program, far away from home, went home, closer to home, practice home, struggle with student debt, trying to formulate and crystallize what you want to practice to create a work-life balance, to learning about finance, to learn about real estate, to getting the spouse aligned, and now heading south, right? That's a lot in a few years. So congratulations. I think this is really remarkable. And when we met you a few years ago, right, and now you're so much more competent, and that's what we enjoy seeing is physicians from East to West Coast. Everybody's in their journeys. I told everybody, your journey is not my journey. My journey is not your journey, right? But we're here to help and empower everybody to ask smarter questions, more relevant questions. And our goal is to ignite some passion or to disrupt you, to get you to think a little bit, to rock your world a little bit, right? So that maybe something inside.
Oh, for sure, yeah.
Yeah, and we feel.
Yeah, I feel like I learned a lot from being part of the physician empowerment. And when I first attended the conference back in 2022, I was just mind blown, and there was so much that I learned from that conference and beyond. And I said to you and Kevin, like, I got so inspired by the group and the conference that, like, I wanted to do some kind of a speech or some, presentation or something about something in the future with the vision empowerment. I just didn't know what it was going to be.
Right. Yes, I remember that. And you know what? You're getting there. You're getting there, right? And so we're going to, in future, we're going to do more about entrepreneurship and something in real estate. Okay, so I want to thank Eileen for your time and for being transparent, sharing with us, for being vulnerable. We talk about leadership development, and we pride ourselves in leading with transparency and vulnerability, right? So we share as a group. It's a very safe space for us to share. So I want to thank you again, Eileen. So all the best with your quest for freedom, for your family. And we thank everybody for joining us. Okay, we'll catch you later.
Thank you.
Thank you.
Thank you so much for listening to the Physician Empowerment Podcast. If you're ready to take those next steps in transforming your practice, finances, or personal well-being, then come and join us at phisempowerment.ca, PHYS empowerment.ca, to learn more about how we can help. If today's episode resonated with you, I'd really appreciate it if you would share our podcast with a colleague or friend, and head over to Apple Podcasts to give us a 5-star rating and review. If you've got feedback, questions, or suggestions for future episode topics, we'd love to hear from you. If you want to join us and be interviewed and share some of your story, we'd absolutely love that as well. Please send me an email at kmilo@phisempowerment.ca. Thank you again for listening. Bye.